thank you all for coming here tonight. What that means to me is that you are avid learners. You want to incorporate more information into your lives because we don't have enough information, right? No, the reality is there's too much information. Now, I want you to look at the person next to you and I want you to say, you're going to learn something tonight. Now turn back to them and say, it's about time too. So we all have too much data. So we're going to try to take down the medical jargon and not really overload you with too much. The goal is to keep it simple because the reality is one of the issues that can happen when your immune system is chronically overactive is something called brain fog. So for those of you who are dealing with that or some of the other things that are going on here, we don't want to make you feel overwhelmed because another thing that makes your immune system go crazy is stress. So the last thing I want to do is make you feel stressed. This should feel like you are picking up enough information to take action, right? So if you can learn one thing that can lead to one action that gets you a better, healthier immune system, how many of you think that would be worth it to do that? Great. That's all we're here is just to incorporate new information and make it better. Now, your immune system, understanding the root causes of chronic inflammation, fatigue, and unexplained symptoms. So how many of you feel like you wake up exhausted even if you were able to go to bed on time? Anybody who have that? You wake up in the morning, you're like, oh, I can't get up. Or have some brain fog or poor focus, which oftentimes can come from that, same thing. Inflammation and joint pain. A lot of people come into this office with or for that. Getting sick frequently, skin rashes because your skin is your largest organ, as you all know. Sinus congestion, allergies, bloating and digestive issues, anxiety or mood swings, or have been told to take medications for any of these things. Anybody? Or just grab some over-the-counter stuff. Now, any of you ever been to a doctor with any of these symptoms and they just hand you what, typically? Yep. Take this, do this. Now, our medical provider here will say that she understands, and I'm sure that you do too, sometimes docs don't have enough time based upon the medical system to question the why behind it. But do drugs ever answer the initial cause or causes behind the issues? Like, did anyone ever get inflammation and joint pain because they forgot to take their medication? It was a medication deficiency. The United States takes, as many of you have heard from many of my classes, we take about 70% of the world's medications, and we're 5% of the world's population. Okay? If that was the answer to getting us well, we'd be the healthiest people on the planet. Is the United States like number one when it comes to health outcomes? No. In fact, we have got more chronic disease than just about everyone else. And let's talk about why. So we want to go into the whys behind it. And so rather than treating just the symptoms, we're talking about addressing the root causes behind it. All right? So it's important that you understand your immune system, how it works, just a little bit. It's a very complex system. You know, there are 21 different types of cells that are involved in immune system, doing 12 different jobs. It's an incredible complex system. And so to really make it simple is difficult. But your body is constantly fighting off viruses and bacteria and mold and you name it, and creating inflammation to be able to do all of these things. But sometimes it doesn't work perfectly. So it's scanning for threats. It's like an alarm system, right? So if you're someone's breaking into your house and you want that alarm system to go off, yes? The one that goes off immediately would be like your inborn or innate immunity. It's reacting very quickly within the first few minutes to day, and it's what's called a non-specific. So it's just like inflammation, let's raise the temperature, let's do some things, let's get those white blood cell count up, let's do whatever we can just to, there's an invader. We don't know exactly what it is, but there's an invader, okay? And then there's your adaptive immune system. over the course of the next few days, your body figures out, wait a second, we haven't seen this kind of bacteria before. We got to do some special things to fight this thing, and then I'll remember it from that point on. That's sort of like the SWAT team coming in. It's a little more specialized, but it takes more time to generate. Does that make sense? Okay. So how many of you have ever been given an anti-inflammatory? Anybody here? Okay, so it's a very, very common medication that's given out. But is inflammation bad? So like did I just create some inflammation to some cells in my hand, right? So that's actually a good thing. It's the body doing exactly what it's supposed to do. I just damaged some cells. Now the body doesn't actually heal damaged cells. You know what it does to it? It gets rid of them. It says, oh, those are damaged. We're going to take those out and replace them with new healthy cells made out of the food you eat, the air you breathe, the water you drink. You are what you consume, right? What your body assimilates. So if you have those damaged cells, your body has to increase your blood pressure, has to increase the amount of cellular flow so that it's kind of putting in the new stuff there. Does that make sense? So that short-term inflammation is really good. It's necessary for healing. The problem is chronic inflammation. How many of you have ever heard the statement that chronic inflammation is the gateway to just about every chronic disease, whether it's heart disease, cancer, diabetes, you name it? Chronic inflammation is usually involved with it. Does that make sense? So there's two problems with chronic inflammation. Either the body doesn't know what's going on and it overreacts. So like when this comes to, let's say, an allergen, right? A small piece of pollen floats into the room and everybody's fine except for that one person who's like, all of a sudden, they're all over the place. It wasn't that piece of pollen, it was the person's immune system overreacting. Does that make sense? The other problem could be lifestyle. So if I eat some poisonous food, and then I throw up, oh man, that was terrible. I'm gonna eat some more of that poisonous food. Why do I keep on having this reaction? It's not that it's a bad reaction. It's that I'm doing something. If I keep on doing this, what kind of drug should I take to fix the pain in my hand? Man, I just hate when this happens. You would just tell me to stop beating myself, right? Unfortunately, many people make choices that are incongruent with health. Does that make sense? So, oh my God, every time I do this, my lungs burn. What should I do? Maybe stop smoking, right? We eat foods that aren't, agreeing with us. Yet, 80% of our immune system is in our gut. So how important is it to keep our gut healthy? Super, super important. We'll get into that tonight, right? So chronic inflammation, that's the villain, and we're gonna handle two parts of that. One is the body confusion. That's when the body's not working properly, or the lifestyle confusion, making sure that you're aware of what to do to not beat yourself up. Now I do, as a chiropractor, have to address the fact that in the body confusion, the thing that controls and coordinates the actions and functions of every cell, tissue, and organ in your entire body, that controls your immune system, that controls your gut, that controls your muscles, that controls your eyes, your ears, your heart, every part of your body is your brain. Now, how does your brain control that? Is it through Wi-Fi, or are there actual wires that tell every part of your body what to do and how to do and when to do? Right? Those wires are called nerves, and that's how your brain controls your body. And that's why people who are under long-term chiropractic care actually have a twice as healthy immune system as the average person. Did you know that? So for those of you who are relatively new here, now you do. So keep your nervous system healthy. Okay? So what if your smoke alarm never turned off? All right, so your smoke alarm goes off. Is that a good thing or a bad thing when the smoke alarm goes off?
Depends on what time.
It's a good thing, right? Well, so if it's 4 o'clock in the morning and it goes off, it's a good thing if it's a fire, right? I'd rather be annoyed and alive than like peacefully roasting in my bed. But if there's a battery that's like beep, that's a different thing. That one always goes off at 4 o'clock in the morning. For some reason, the smoke alarm never chooses to have the battery go bad at like noon. But you put the fire out, but the alarm keeps on going off. And that's what we're talking about when it comes to chronic immune activation. So then your nervous system and your immune system go into like mode. So what if we could get your body to reset that? What if we could get your immune system to actually recognize when things are okay or learn how to build strength, right? So like if I go into the gym and I lift 4 pounds, I'm gonna be okay. But if I go and lift 400 pounds, well, I'm also gonna be okay because I'm me. But I'm just kidding. But if I did too much, it's gonna hurt me, right? So if your immune system is weak, sorry, I throw some stupid jokes in there. Gotta keep you awake. But if your immune system is weak, then the thing to do isn't to become the boy or the girl in the bubble and remove all of the things that could possibly set you off. It's to make your immune system what? Stronger so that you can survive in your environment. Okay. I think this was...
Okay. All right, so we're going to talk about what things contribute to that chronic immune activation. And when we say immune activation, that's actually saying chronic inflammation that's happening, right? So if you imagine you think of your immune system like a bucket, right? What's contributing to that activation, that inflammation? It can be having bad sleep over periods of time, or even just one night, that'll cause some inflammation. It can be drinking water that has chemicals in it. It could be processed foods, right? So each one of these things individually isn't gonna overflow the bucket, right? But combined, if you're having different things in your life, then there comes a tipping point where now our immune system is manifesting symptoms, right? We're having brain fog, or we're feeling fatigued, our joints are hurting, maybe we do have GI symptoms. So it's about addressing each one of these things to lower our burden, right? So that we're not overflowing and having this immune activation wreaking havoc on us. Okay. So these are some of the things that I talked about that can tip us over, right? So it can be our diet, our processed foods that we're eating, being chronically stressed. No one here has that going on, right? No one's stressed? Yeah. Poor sleep is a really big one. If we're not moving around, right? If we're just staying still all day, that can drive our immune system to create inflammation. Mold, our indoor air quality. So there are a lot of different things that maybe if we're just looking at one, we're not thinking it's a big deal, but when you put those together, oftentimes we're experiencing a handful of these things, right? And then that's what's driving our chronic inflammation. So our job is to try to pinpoint those and try to get to the root and retrain the immune system, right? Whether that's going through the gut or through immunotherapy, where we're actually giving some of the allergens to us to become accustomed to it. Okay, so like Dr. Matt said, a large percentage of our immune system resides in our gut. It's actually 70%, which is...
I overestimated, yeah.
But it might, it's a large percentage that resides in our gut. So that consists of our microbiome. Has anyone heard of the microbiome before, right? So those are the good gut bacteria that are responsible for doing a lot of different jobs for our body, creating neurotransmitters, helping our immune system, processing our hormones. We got more of those bacteria than we do our own cells in our body. So they're very important.
Crazy? I mean, like literally, if you take cell by cell basis, you've got more not you DNA in you than you.
Yeah. Are you really you, or are you just... Yeah. And so in our gut lining, we have, or in our gut tract, we have something called gut-associated lymphoid tissue. It's this huge organ that's constantly sampling everything we're putting into our body. Is it threat? Is it not? Is it okay? So it's constantly working, and really the tube that runs from our mouth all the way to the backside of us, right? That's the outdoor or the external environment on the inside of us. So we got to be really sure and good that we're not allowing any threats or pathogens to come in and get to our bloodstream. So that is what it does. Then things can go wrong, right? If we get leaky gut, has anybody heard about leaky gut? So if we're having inflammatory foods, if we have a lot of chemicals in our diet, we're taking a lot of antibiotics, different medications.
Antacids can create...
Antacids can be a huge problem, right? Mm-hmm. So we don't digest our foods appropriately, but intestinal permeability, the gut becomes leaky, right? And I'll talk about this more a little bit later, but essentially now we're letting particles that shouldn't get through into the bloodstream through, and now they're driving immune activation, driving inflammation. And there's also something called the gut-brain immune axis. So that's why you can develop a brain fog. You can develop those neurological symptoms from having gut dysfunction. There's our vagus nerve that runs from the gut all the way up to the brain, right? So a lot of communication happens between the gut and the brain. Something interesting that research is showing us about Parkinson's disease is that it starts in the gut. That's a neurological condition, right? So that starts in our gut and travels from the vagus nerve to actually the olfactory center, the smelling center. Yes?
Are you taking questions throughout the
We'll
talk,
take
or
some
wait?
questions at the end if you want to write down some of your questions.
Okay.
Another interesting thing about your gut is the vast majority of the serotonin that's made in your body is actually made in your gut. So for people who have depression or anxiety, if your serotonin levels are being suppressed there, it's only about 10% or less that's actually made in the brain. So antidepressants are officially known as selective serotonin reuptake inhibitors. That's one classification of them. And people are doing that so they can boost that little bit. But if you could boost the big part of it by helping your gut to heal, it can help a lot of this too.
Yeah, so it's 80 to 90% of our serotonin and dopamine are made in our gut. So it's not just depression, anxiety, but ADHD, which is on the rise in a lot of young people today. And it's oftentimes rooted in the gut and our diet that we're eating. Okay, so we got a healthy gut, right? So that's where we have our gut lining. So if you imagine our gut, right? Here's our gut lumen. We got our food that comes in. We're supposed to digest it and break the particles down into small little pieces with adequate stomach acid. So you can only do that if you have adequate stomach acid and digestive enzymes. And this gut lumen is supposed to break that down. And on this other side of the gut lumen, we got the bloodstream, right? So those particles are able, the teeny tiny ones, are able to get through, get into the bloodstream, and be shuttled off for nutrition wherever the body needs it, right? So healthy gut. Then we have intestinal permeability. Now, if we have increased intestinal permeability, these junctions that our gut lining is made up of are supposed to be tight, like this, and only let the small particles through. If we have inflammation, it becomes leaky. So now particles that are very big that weren't meant to get through now can get through, and they can drive inflammation. It alerts the immune system there's a threat, and inflammation ensues. And that's how a lot of autoimmune conditions can develop too, right? That immune activation, and then it can go attack the thyroid. Your immune system is thinking that there's a threat at the thyroid, so now the thyroid tissue is affected, or it could be the joints and rheumatoid arthritis. So
One thing that I can add is that inflammation can also become a cascade, where it's sort of like a snowball effect. And so one of the things that happens if cells get all inflamed and irritated, imagine if there's toxicity inside that cell. And it's sort of like if you wrapped yourself in saran wrap and you couldn't breathe and you couldn't eliminate, and so if the cells are inflamed, then they can create more inflamed cells around them because they become toxic and they let off like almost chemical reactions where they're like, I'm freaking out. So as they die, they're turning over more inflammation. So stopping that chronic inflammatory reaction is important, whether it's through detoxification, making sure that your body is able to heal through that.
Okay, so, right, we got immune activation, and then we get the chronic symptoms that can happen. Those can be very vague. So I mentioned the autoimmune type reactions, the fatigue, brain fog, skin issues. Oftentimes, the gut mirrors the skin. Did I say that the right way? Mm-hmm. Right? So the skin is showing what's going on in the gut when we've got eczema, acne going on, psoriasis.
Mm-hmm.
And
sometimes inflammation is at a lower level, so it's not even presenting as symptoms that you would even recognize. You could have inflammation and not even know it.
Yeah, they can be very big symptoms. And sometimes food sensitivities will develop, and you just, over time, you realize I can't tolerate as many foods, and it kind of becomes bigger and bigger. Okay. So, like Dr. Matt was saying, they can show up And the symptoms can show up in different ways. It can be with the brain. So our mood, the mental clarity can be affected. Our skin, like I mentioned, the joints can become inflamed, and doesn't have to be, it can be migratory, right? Some days it's your hands, some days it's your knees, and you don't know what's going on. Energy can be affected. Obviously the immune system, where you might be getting sick often. You don't know why, you're always the one getting sick. And digestion. So some more overt GI symptoms. And I think I talk more about GI map like in depth, but a really useful test for us to understand what's going on in the gut is called a GI map. So comprehensive stool analysis, I'll talk more about exactly what it's looking at in a few slides down the way, but really cool test. Okay. So the immune system can be triggered by environmental allergens, right? So that could be your pollens, the dust, mold. We got a lot of mold in Florida, right? It can be from the nasty bugs, cockroaches, dust mites. And you know, you don't know when you maybe don't know what's triggering these symptoms. So it could be itchy eyes, or some vague symptoms too, like I was talking about before, but itchy eyes, runny nose. And so that's when testing can be helpful to understand exactly what's causing you to have your symptoms.
Now, I mean, a lot of people, like I said in the beginning, come in here, and one of their big things is like just lots of chronic, systemic aches and pains. So like, you know, if you're like, I hurt here, and here, and here, and here, and here, oftentimes there's a systemic inflammation going on. And wouldn't it be crazy if you were just having in addition to obviously some mechanical things, a chemical reaction to either something that you put in there or that you couldn't control that just got in because you can't control the air you breathe. But that oftentimes can be involved in that process. Right? So if we're just addressing the mechanical when there's a chemical portion of that, it wouldn't be a full respectful treatment.
And oftentimes the chemical or, you know, dietary component of that is a big trigger for your perception of pain. So I can see two different patients with the same kind of film, right? They have the same kind of degeneration in their joint. One is pain-free, one has a tremendous amount of pain, but one has a very good lifestyle or a low inflammatory load, right? Less systemic inflammation, and the other might be having a lot of inflammatory triggers, poor diet, poor sleep, whatever it is. And that's why their perceptions of pain are very different despite having the same films, x-rays. So we got, right, the food triggers, gluten and dairy, really big ones that are inflammatory to the gut lining. Some people can have issues with different types of groups of food, nightshades, histamine-rich foods. Alcohol and caffeine can also be triggers. Then we've got the internal environment in the gut that can just perpetuate the inflammation, right? So maybe we're not eating a great diet, or we're very stressed, that's leading to that bad balance in the microbiome, and then those bad bugs that we've allowed to overgrow then make more inflammation by creating toxins, toxic byproduct. And then if we have leaky gut, it's the perfect storm, because those toxic byproducts those bugs are making get through into the bloodstream, and now the inflammation is even bigger. Okay, so we've got two different kinds of reactions that can happen. So IgE, I think of Ig immediate. I know immediate starts with an I, but immediate, right? So that's a reaction that happens pretty quickly after you come into contact with it. So that's like a peanut allergy, a bee sting, minutes to hours is when the reaction will happen. Then we have our IgG, so Ig gradual, so longer, it's a delayed reaction, so it happens 2 to 72 hours after exposure. Oftentimes, these are more insidious and not as apparent with the symptom presentation. The fatigue, malaise, the brain fog, you're not really sure what you came into contact with to cause it, but it's there, right? And so, let's see. Okay. How can we figure out what allergies you've got, right? That's what you want to know. So when we're talking about environmental allergens and pollens, we do skin testing here. So that is a little scratch test. We'll show you an idea of how that goes tonight. But for that, I might be jumping ahead of myself, but for the skin test, we look at 72 different environmentals and pollens and look to see what you're responding to. So with that, we're able to create a serum that's tailored specifically to what you reacted to retrain your immune system. So the skin testing is good for the environmental allergens. Then we can also do the GI map testing to see about the gut and how the immune system might be overreacting to different foods, or maybe you just have a bad balance in the gut that we need to calm down the inflammation. Okay. So here we are talking a little bit about the serum that we create from skin testing. So I'll go into that a little bit more here. Basically, from the skin test, those 72 allergens, we look at what you responded most to, and then I'm able to send that off to the lab, and it's created specifically for you, and then you would do 2 injections per week to retrain the immune system. And then I'll go into more about the maintenance phase in a few slides from here. Okay. Talked about that. I knew I was jumping ahead of myself. Okay. So, do you want to talk about this?
Sure.
Okay.
Talk about it because I'm currently doing it. So that first phase, the first few months, you're doing a really tiny amount of it. And so one of the big differences between the way that she does it versus a sort of a typical ENT allergy program is we're starting off at a very almost like non-therapeutic dose. We're getting it to the point where it's so innocuous that you're not going to have an overreaction to it. And it takes time. But then over the course of time, you go into that building concentrations where your body is learning how to tolerate and build that immunity to it. And then once you've gotten through that and your body's calmed down, then it's just all about kind of keeping it there. So this is oftentimes where the biggest gains are made in that 6 to 12 month range. And then some people, need a little bit of boosters for a little bit of time. Some people continue to grow that depending upon the depth and the number of reactions that they had. But many people are also done at that 1 year mark.
So this is all to help to identify a trigger that might be tipping you over, and when that bucket of immune activation that we talked about early on, where things build up and we have that tipping point, this is helping to lessen that load on your immune system. Okay.
So oftentimes, these are some of the outcomes that people, experience. Obviously, if it was interfering with your sleep quality, then obviously you sleep better. If you were having hives or other types of reactions in your skin as a measure of your gut health, improved skin quality, and then obviously if you had brain fog, clearer thinking. So, and then for me, one of my bigger ones was just breathing. I like breathing, and I'm starting to do it better now, which is good. I try to do that every day. All right. So we just had some typical outcomes. You can read them yourself. I'm not going to go through the sort of the testimonials here, and I'm not going to read Google reviews. But so oftentimes the things that are stopping us from taking action are whatever excuses we have. Like, so oftentimes if you have a problem, it starts off as a mild problem, and then it becomes a moderate problem, and then it becomes a severe problem. The more leveraged you are, this is when you have fewer options and you start to do things that you wouldn't normally do, right? And it's going to always cost more time and more money when you're here than when you're proactive rather than reactive. Does that make sense? So I would urge people to kind of figure out, like, especially if you guys filled this out. So there's a calculator at the end. If you scored more than 15, I'm going to recommend that you set up a time with Samantha to get checked out. Okay. Just to let you know, because some people, one of these reasons why people wait too long is because they're afraid of money. If you have insurance, oftentimes the serums are covered by insurance. We can certainly verify yours, but if they're not, we have a special for the people who are here tonight as well. Go on.
Okay.
Okay. All right, so there's two approaches to your health, as we just talked about. There's the old model of healthcare, which is the reactive model. Wait until it gets severe, treat each symptom separately as if it's a unique, not part of a greater whole, mask it with medications. We know that that is not necessarily the most effective way to take care of your health. The people on the world's most drugs are not the world's healthiest. Go to different people, do different things, and don't identify the root, versus being more proactive and working in a place where we can take care of everything all at once. Okay. So this is how it goes. We have that, it's not only our philosophy, but our plans are designed, whether it's with our immunotherapy testing, functional medicine, regenerative medicine, hormone optimization. She does it all. And then we do the chiropractic as well. And then GI map testing, she can talk more about.
Okay. All right.
So that's pretty much it. So we're here right at this point to fill those out.
I was going to talk about the GI map.
Yes.
And then the P88 test that we do.
Okay, so keep going.
Real quick. Okay. So the GI map that I talked about earlier, comprehensive stool analysis, right? It is a specialty test. Not ever. I haven't seen it run by a normal GI before. Not covered by insurance, and that's why they probably don't recommend it, honestly. But it tells us a lot of information and takes the guesswork out of your gut health. So it tells us about the composition of your microbiome, right? What the balance is like there. Do we have enough good guys? Do we have too many bad guys overgrowing? Are there any pathogens present, like bacteria, viruses, fungi, parasites? And do we need to address that? Tells us about H. pylori, that's a common one. And if there are pathogens present, and we need to use an antibiotic to get rid of it, which sometimes is the case, unfortunately, it'll tell us what antibiotics it's sensitive to. So we're not just kind of blanket throwing it at it, the bug, right? We want to be sure that it's going to work and it's not resistant to it. Also tells us how well we're digesting our foods. Do we have an issue with our enzymes that we need to address? Is there a lot of inflammation and more of an inflammatory bowel pattern? Do we have leaky gut? It tests for cool protein called zonulin, which when that's increased, it tells us there is a lot of leakiness going on in our gut. So with all that information, we can make a really solid gut protocol to heal your gut and get those symptoms under control, those more overt GI symptoms or vague symptoms. Really useful test. Sometimes, despite working on the gut, we might be eating something that we think is healthy, that isn't inflammatory, but is a trigger to us that our immune system doesn't like. And until we take that out for a period of time and let the gut calm down, the immune system calm down, it will not heal, and we don't understand why. So this test, P88, it's called the P88 dietary antigen test. So it's looking at food sensitivities and allergies. So it's looking at those more immediate allergic reactions that you could have to foods, but also the delayed ones, the food sensitivities. And the cool thing about this particular test, it also checks another marker called C3D, and that tells us if your immune system is getting particularly inflamed by certain foods. So a lot of food sensitivity tests don't check for that additional marker. So this is a good way to just understand exactly what food is triggering you. Okay, so a little bit more about the allergy serum shots that we talked about for environmentals, antigens, and pollens. It's like Dr. Matt said, a gradual build. So when you go into the allergist office, it's more strong in one sitting, and you can have a lot of reactions. You have to be monitored. This is convenient because you get to bring it home, and you can just do it over a longer period of time for that build to retrain the immune system. Dr. Matt talks about this a little bit already about when you can notice results, right? So within 3 to 6 months, and that goes for with the gut. When we do more gut-focused work, it can be within 1 month that you notice things changing, but it does take a period of 3 months, I would say, to go through the phases and adequately build back the microbiome. Okay, and when we meet to do any of this, I talk about what you're currently taking, if there's any reason why you shouldn't be on that while we're doing the work that we do. So like whether you're on antacids, right? Maybe stay on it for a period of time, but the goal is to get off of it. But generally, you don't stop any medications that you're prescribed. Okay.
We already went through that.
What's that?
We went through that one.
Okay. All right.
Is there anything else?
I think.
All right, so that's pretty much it. Just to kind of tell you what we are offering tonight. The normal price of the testing, are we going to do a demonstration tonight?
We have our patient over here. Come on, Lenny.
Okay. So if you don't have insurance for it, and insurances that are definitely covered are most PPOs,
one side off, I'll do
Medicare
here.
covers 100%. Humana, replacement, what's that?
Give me a couple weeks.
Give a couple weeks. You look so young. But otherwise, it's normally $250, but we're charging $150 if you have no insurance for it, for the testing. And then if you haven't done an intake with Samantha for functional medicine or anything else, or an allergy testing or anything, normally it's $69 for the the new patient exam or the intake with her, and it's doing for $49. So those are our little specials. So if you want to do any of the testing, whether it's the gut testing or the skin testing, which she's going to go through right now, and you did score at 15, like a moderate, all the way up, definitely if you're in that red zone there, you really should do it. But even if you're like in the mid-moderate, it's a good idea. If you're green, probably, not going to get as much out of it, to be honest. So there's a couple options. Finish filling out that survey, and then circle if you want to get checked. You can either do one of two things. If you have time, you can go ahead and schedule it with Laura at the front desk over there. She's waiting for you. Or you can just put your name on the survey, hand it to us, and we'll schedule a time. We'll call you or text you and figure out a time to get in touch with you about that, okay? So you can sit and watch.
So this is an example of the skin test that we do for the environmental and pollen allergies or allergens. It is a scratch test. Looks like a little ant, right? And they're not needles, just some pointier plastic at the end of the ant legs, okay? So first step, we clean the arm. So we're gonna be using the upper arm and then forearm area. How many different? There are 9 different sections that I do total. And so
Let me take this from you.
Thank you.
Sure.
I'm just gonna do a few sections on her, not the whole 9. And we're gonna pretend that we have our antigens, okay? So clean her, and then I use this as a guide. We're just gonna mark our areas so we can keep track of what we're testing. So we just work around the arm. And then I like to use the inside of the forearm too. So when I'm doing this, actually, I work on both arms and then get the antigens the serum that we have out of the fridge and dip it right in, carry it over. I'm going to use a new one on her.
Good catch.
Okay, and then we press into the skin. Not bad, huh? Okay, and then throw this one out, get a new one for new antigens, repeat the process. Then we wait 15 minutes, let hives develop, and the bigger the hive, the greater the reaction. There is a control that we do, so 1 histamine to make sure that it's a reliable test, because you shouldn't be on antihistamines for at least 72 hours before the test so that your immune system can actually mount a response what it would normally respond to. So we want to make sure with the histamine that the immune system's acting the way that it should be, right? So we wait the 15 minutes and then little hives, like insect bites pop up, and then I go and I measure your response. And if they're large, like I said, bigger immune activation, and then all the big ones I tally at the end, and that's what we create the serum with. So the immunology lab creates that, and that's what you'll be injecting. So it's tailored to you. Has anyone done skin testing before? All right, cool. Questions? No? Okay.
Now's a good time to ask questions that you had from before.
Oh, okay. Since, well, it doesn't have anything to do with
Let me
what
get this.
family's doing, but my children have undergone
Huh?
in the past
Okay,
allergy
you go then,
testing.
'cause this
They
is-
had, the family suffers from allergies. My husband suffers terribly from chronic sinus,
Okay.
tiredness.
Still?
Oh, yeah. But, you know, no offense, but men do not take care of themselves, I don't think, as much as women do. So it's hard for me to get him to, but I have some
Look around the
information
room.
that I'm gonna.
We've got one guy in the chair there.
Thank you.
But what I thought was interesting,
Yeah,
when
you're
we were
good.
talking about the gut
Thank
and
you.
a lot of interesting things came up tonight regarding your immune system and how the gut really affects your immune system, which I think a lot of us are probably not that aware of the gut being such a powerful contributor to immune. Now, my father-in-law passed away years ago from a neurodegenerative disease, which at first they thought was Parkinson's, and it turned out to be something else. I don't remember what they called it, but I was originally going to ask you regarding foods, because my children, and I notice a lot of people are really into eating these hot, spicy hot foods that I can't handle. I don't like them, and once my mouth is on fire, I don't taste the food anymore. So I don't know, but there's such a great population today that loves these hot, spicy foods, and I wonder what the effect of that is on your gut as far as permeability that you were talking about. And then when you mentioned about how Parkinson's begins in the gut, now I was thinking about my father-in-law, who not only ate these hot, really hot, spicy peppers and things, and plus he drank a lot of alcohol. If that was such a big contributing factor, could it be towards these neurodegenerative diseases?
The alcohol for sure is not good, because any amount of alcohol is an injury to the gut, right? So it's not only inflammatory, but also it's changing your microbiome and how that functions. And then you can have the toxic byproduct from that. So the alcohol for sure. The spicier foods, you know, there's benefits to cayenne pepper or, you know, to certain spices. But like anything, there's the right amount to have. You don't want it in excess or too little, like moderation, right? Because if someone is eating the foods that are like making them cry,
Yeah, he would cry.
you know, and you're eating that regularly, then there is probably an inflammatory component that's not
So
good.
you're saying alcohol is probably
But alcohol's
worse.
the biggest one, yeah. Because not just for the gut, but then also the liver, you know, it's just chronic inflammation.
Drugs can do that too.
Yeah.
I have a question. How do vaccines affect the immune system? So they like play havoc with it?
Yeah, that's a loaded question. So they're meant, yeah, quiet exit. They're meant to introduce a small amount of the virus right into your immune system so that it trains it, so it has this adaptive response, right? So that it's able to recognize when you come into it in the wild, and then you can dampen that immune response and tolerate it and not have the symptoms. But vaccines are not just those little bits of dead virus or live virus, right? There's other components in the vaccine, and that could not be good for a susceptible population. So I don't know if that's answering your question.
Okay. If